welcome back to the Men's Hub. I'm going to be talking today about testicular cancer. Now, first and foremost, I'm just covering a few bases around testicular cancer. If you have got a diagnosis of testicular cancer, I would really recommend you go to the Cancer Hub, where there's information about all types of cancers, radiotherapy, chemotherapy, nutrition, diet, lifestyle, herbs, and there'll be handouts on this condition. But for now, let's cover just what this is. So it's a cancer that occurs in the testicles, which are part of the male reproductive system, and it's a relatively rare but highly treatable cancer, especially when it's detected early. In most cases in men, it will appear between the ages of 15 to 35, but it can affect men at any age. Now, the risk factor age we've already given, but familiar history, a close relative with testicular cancer will increase your risk. If you suffered as a child from undescended testicles, so this is cryptorchidism, then even a corrected surgery will still leave you at an increased likelihood of cancer. If you have a personal history of having had testicular cancer in one testicle, it will increase the risk of developing it in the other, and it is more common in white men compared to other ethnic groups. Now, the common symptoms for testicular cancer is a lump or a swelling in one testicle. It's a feeling of heaviness or aching in the scrotum or lower abdomen, and it can involve testicular enlargement or tenderness of both the testes and of the breasts. There can be pain or discomfort in the testicle or the scrotum. There can be a sudden fluid buildup in the scrotum, and there can be unexplained fatigue or general malaise, and you might find that you would lose weight as well. Now, many of those symptoms on their own can be non-cancerous, but it is important that you get a consult with a healthcare practitioner if it persists. Now, first and foremost, self-examination. So when to check? Perform a self-examination monthly. So you want to know what your testicles feel like. You want to feel all around them. And ideally do it after a warm shower whenever the scrotum's a little bit more relaxed and you're able to get your fingers in and around the back. Now, how to check? Roll each testicle gently between your thumb and your fingers. So it literally is this type of a motion. And you want to look for lumps and swelling or changes in size or shape or consistency. So what are we looking for? Well, if it's a painless lump or there's a swelling in just one testicle, then that's worth getting investigated. If there's a change in the size or in the firmness of the testicle, it's worth getting investigated, or any irregularities which could be evaluated by a healthcare provider. Now, diagnosis is generally by ultrasound, and it can also be done by blood tests. So there'll be tumour markers in the bloods. They're called AFP, HCG and LDH, and often accompanied with that is going to be a physical examination. Now, just because you are concerned about going and having your testicles held by another healthcare professional or by another man, it is not enough of a reason not to go. This is something you really do want to get seen as soon as you notice something gone awry. The treatment options are really positive initially, but they'll include things like surgery, the removal of the affected testicle if it is particularly serious. Radiation therapy can often be used. For seminomas, this is a cancer within the seminal ducts. The chemotherapy might be offered for aggressive cancers, and surveillance. So this is just a watch, wait and see idea, particularly if it's slow growing. Now, natural and lifestyle support for testicular cancer. So there's a lot more information here on the Cancer Hub, but I would include things like antioxidant-rich foods that are dark berries, leafy green vegetables, citrus fruits to help support the immune system. Cruciferous vegetables are particularly useful for hormonally based cancers. So this is broccoli, cauliflower, kale, that can help detoxify harmful substances for the body. Healthy fats such as omega-3 sources like salmon, walnuts and flax seeds can help reduce inflammation. You want to eat whole grains, things like brown rice, oats, quinoa, that help provide sustainable energy and sustainable fiber. Limit processed foods, reduce your sugar, reduce your carbs and the trans fats, the Frankenstein fats. When it comes to herbs, there's so much that can be done for cancer, and again, the Cancer Hub is the best place to go. But if you're just looking for over-the-counter things to help Then milk thistle would be really helpful for your liver, to support your liver during chemotherapy and other treatments. Turmeric is an anti-inflammatory that can help inhibit cancer cell growth. Green tea contains catechins, which are potential anti-cancer properties, and ashwagandha, which helps reduce stress and supports the immune function. I probably would put in some herbs such as phytolacca, thuya, that are great lymphatics to try and help move circulation in and around the testes, and that might be used topically. Castor oil might be used topically, and there's a number of things even that can be used as suppositories, as well as internal anti-cancer and cytotoxic blends. Now, when it comes to stress management, you want to address your cancer diagnosis. That can cause real emotional strain, and techniques such as mindfulness or meditation can really help. You might want to consider some counselling or support groups to help provide emotional and mental support. Exercise is extremely useful at reducing fatigue, at improving mood and improving overall outcomes. So activities such as walking, swimming and yoga are all ideal during recovery. So when to seek professional help? The moment you experience lumps, pains or swellings in the testicle. Any concerns rising from self-examination and unexplained fatigue or other symptomatic symptoms. Early detection and treatment are key to successful outcomes in all types of cancer, but particularly in testicular cancer. It's important not to be prudish and to ensure that you are having your testicles checked. Now, if you have a diagnosis, you might want to find something like a daily routine to help you in recovery. So I would recommend things like green smoothies, spinach, banana, flax seeds, turmeric at the start of the day, followed by lunch with grilled salmon, some quinoa and steamed vegetables, some exercise during the day, and then some colourful vegetable stir fry in the evenings with coconut oil, and a way to meditate in the evening. It's very treatable. It's not something that I would get particularly worried about unless it's very advanced, and there's a lot that can be done herbally. So if you have any more questions, get in contact or go and by all means find out more information from the Cancer Hub. Cheers.